Yeah, hi Venus. Welcome to a quick revision series. This is Dr. Srikanth from Team MDS CONQUER. Now I'll be discussing about a few important topics related to your examination. Okay, so now you have a clinical photograph in front of you. So where you can see an ulcer, which is crater-like ulcer on palate. Okay, on palate you can see. So the diagnosis of this is necrotizing sialometaplasia. Okay, so diagnosis of this is necrotizing sialometaplasia. The important things that you have to make a note about this is most commonly associated with minor salivary glands which are present on the palate. So palate is the most common site of occurrence intraorally. And this is most commonly seen in the males when compared to females with 2:1 ratio. And of course in the diagram you can clearly see this is a unilateral, okay, so it occurs in bilateral also, but most commonly a unilateral, and it is painless. Sometimes pain may be present along with numbness. Okay, and the mean age which is given in the Schaeffer's is around like 48 years. Okay, a similar lesion can occur on the skin. The lesion which occur on the skin is called as syringometaplasia. A similar lesion can occur in the breast of the female. So that is called as post-traumatic lobar metaplasia of the breast. Okay, so it can occur on the skin. That is called as syringometaplasia, and this question was also repeated so many times in the exam. It can occur on the breast, that is called as post-traumatic lobar metaplasia. So etiologies which are given in the Schaeffer's is, as of course, like it occurs in the breast. Okay, trauma is one of the etiology. Okay, so the other etiology is decreasing in the vascular supply. Okay, decreasing in the vascular supply, trauma. Okay, it can be due to radiotherapy, it can be due to surgery, or it can be due to tobacco. So these are the etiological findings which are given in the Schaeffer's. Okay, so please do make a note of this. And followed by the most important area is we need to talk a few lines about histology. So first of all, we'll go to this. Okay, so that is N and S. That is necrotizing sialometaplasia. Okay, so necrotizing sialometaplasia, N for necrosis. So you can see on histology, you can see necrosis. The necrosis which you can see is basically called as coagulative necrosis. So you can see on histology, you can see coagulative necrosis of the glandular tissue, that is salivary gland related glandular tissue. Okay, that is called as necrotizing. Why coagulative necrosis is decreasing the vascular supply is one of the etiology for occurrence of coagulative necrosis. Next one is sialometaplasia. This means you can see metaplasia. One is you can see necrosis. The second one you can see metaplasia of the ducts. Okay, the most important thing where the questions are being frequently repeated is, please do add this particular word, where you can see pseudo epitheliomatous hyperplasia. So what all you can see, one is you can see necrosis. The type of necrosis you see is coagulative necrosis, that is because of the vascular supply decrease. Second one you see metaplasia. Third one you see hyperplasia, that is pseudoepithelial hyperplasia you see. So these are the three important lines that you have to make a note when you're talking about the histology of this particular SM. NS. Okay, right. So next comes is the treatment. There is no need of no treatment, and the prognosis is excellent, and it heals spontaneously. It heals spontaneously. Sometimes surgery may be required if the response is not proper, but in most of the cases the recovery occurs spontaneously. There is no need of treatment. You need to follow up the patient. So these are the important points related to necrotizing sialometaplasia. Necrotizing sialometaplasia, okay, preferably the question will be with this particular wording called as crater-like depression seen on the palate because of minor salivary glands. Most commonly seen in the case of males when compared to females. It is painless. The mean age is 48 years. Skin lesion is called as syringometaplasia. Breast lesion is called as post-traumatic lobar metaplasia. etiologies, decreasing the vascular supply, trauma, radiotherapy, surgery, usage of tobacco. Okay, then comes histology, 3 important things: necrosis, necrotizing, that is coagulative necrosis, metaplasia in the ducts, and pseudoepitheliomatous hyperplasia. You can see treatment, no treatment, in most of the cases it recovers spontaneously. Okay, so these are the important points that you have to make. When we're talking about the differential diagnosis, the next scene comes. Okay, so previously we are talking about crater-like ulcer. Okay, so crater-like ulcer on the palate, that is called as necrotizing sialometaplasia. The second category is, you can see crater-like depression on interdental papillae. So this is again a very frequently asked question. Okay, so crater-like depression on the interdental papillae, yes, your answer should be Anak. Okay, so the question was given in the last 2 years of NEET examination also. So make sure crater-like depression, okay, crater-like ulcer or crater-like depression like ulcer or punched out ulcer of interdental papillae, you're punched out also. Punched out ulcer of interdental papillae, crater-like interdental papillae. So if whenever they use these words to interdental papillae, your answer should be Anak. Okay, ulcer on the palate, your answer should be necrotizing sialometaplasia. Okay, so next comes is like whenever you have some few other important lines related to palate. So whenever they give unprotective sexual contact plus a palatal ulcer or lesion, or whenever they mention perforation, now you need to go for sexual contact related microorganisms. Okay, one most important thing which is going to cause this is syphilis. Syphilis, and the lesion is gumma. Okay, the most common area for occurrence of intraoral area for occurrence of gumma is palate. So other important areas that you have to make a note is the most common occurrence of intraoral nevi. Okay, the answer is palate. The most common area for occurrence of intraoral occurrence of case Kaposi's sarcoma. Most common carcinoma that is seen in the case of HIV positive patient, Kaposi's sarcoma. The most common area for occurrence of Kaposi's sarcoma is again palate, hard palate. These are hard palates. Okay, so please do make a note. Gamma, most common occurrence is palate. Okay, then syringometaplasia, your necrotizing sialometaplasia, the most common area is occurrence of palate. Intraoral nevi, occurrence is hard palate, and intraoral Kaposi's sarcoma in HIV patient, occurrence is hard palate. So please do make a note of these important lines. Then comes, most of you are familiar about this blue color cylinder. Okay, so very important in conscious sedation, that is your nitrous oxide. So a few lines about your nitrous oxide. So nitrous oxide is one of the most commonly used gas in the case of your conscious sedation. Okay, conscious sedation is one of the most important topic in your pedo. Coming to dentist, conscious sedation is more important. Okay, so the points to be noted when you're talking about the nitrous oxide is the color of the cylinder. Okay, cylinder color already mentioned, it is blue color. Okay, the next comes is the few other important values that you have to make a note when I'm talking about nitrous oxide. That is MAC value. MAC value is minimum alveolar concentration value. The minimum alveolar concentration value is 104%. Very good. Okay, right. Next comes is blood coefficient value. Okay, so blood gas coefficient value of nitrous oxide is 0.47. Then comes the specific gravity or density value is 1.53. Okay, is 1.53. Now I want you to tell me the pin index value. Pin index value. So please do mention the pin index value in the comments. In the comments below, please do mention what is the pin index value of nitrous oxide. Very important. Okay, pin index value table will be there for most of the gases. We have a mnemonic for that also, which has been discussed with you so many times. So the pin index values are very, very important. Please do mention the pin index value of nitrous oxide in the comment section. Then comes the next important aspect that you need to make a note is the next one, that is, you can see one more cylinder that is called as entonox. You can see this is entonox. So what is entonox? Entonox, coming to the color, entonox is going to have a blue cylinder with white shoulder. Okay, again I'm telling, okay, color coding of these gases which are used in general anesthesia is very important, so please do make a note of it. Okay, you have a table. Whenever cylinder is having a shoulder, the shoulder is always white. Entonox is blue plus white. Okay, blue plus white shoulder. Okay, a blue cylinder with a white shoulder, whereas nitrous oxide is a blue cylinder. Okay, now what is entonox? Entonox is basically 50% of nitrous oxide and 50% of oxygen. The few other important lines that you have to make a note when I'm talking about nitrous oxide. A few of you has asked doubts regarding this. So what are the problems or contraindications related to nitrous oxide? So these are the lines which are given in show attendance. So I'm just trying to focus on those lines. It is contraindicated in the case of pneumothorax and in the case of upper respiratory tract infections. Okay, nitrous oxide is contraindicated in pneumothorax, respiratory tract infections, and one more important thing is pulmonary fibrosis. Means the patients under the usage of aclomycin are prone to pulmonary fibrosis. In these individuals, nitrous oxide is contraindicated. Nitrous oxide is contraindicated in pregnancy women because this may lead to abortion. Okay, and of course one more very important area, the question about nitrous oxide is diffused hypoxia. Okay, so we learn about diffused hypoxia is one of the common thing that occurs after the usage of nitrous oxide. The patient is going to have the following symptoms like headache. The patient is going to have immediately after nitrous oxide, the patient is going to have headache, disorientation, and all these problems. What is the treatment of this? Yes, you're right guys, the treatment is giving 100% of oxygen for 5 minutes after the procedure. Give 100% of oxygen for 5 minutes after the procedure. You can avoid this diffuse hypoxia, which is one of the most common complications that is seen after injection of or after using nitrous oxide as a constant sedation in the individuals. Okay, so apart from this, one more important vitamin that we need to make a note, which is given in your Schobert tendon, is nitrous oxide is going to decrease the DNA synthesis. How it's going to decrease the synthesis? Because nitrous oxide is going to act on vitamin B12 oxidation. Okay, vitamin B12 oxidation, and it's going to decrease the synthesis of it. And nitrous oxide has an indirect effect on occurrence of altered hemopoiesis. That is, it may lead to pernicious anemia because it's playing with B12. Okay, so B12, right? So B12, it may cause altered hemopoiesis or it may cause pernicious anemia. Okay, so these are the important lines that you have to make a note when I'm talking about nitrous oxide. Okay, then comes the next one. These are the few lines taken from your power play books ortho part. Okay, so I mean I have given few codes, so please try to follow it. Mode of ossification. So when I'm talking about mode of ossification, the first one is endocondylar ossification, in which a cartilage on ossification is going to convert into bone. Okay, so the most common example for this is ethmoid bone. Okay, the most common, most of your questions will be moving around this. For this you can remember the code HISE. H for hyoid bone, I for incus, stapes, and ethmoid, HIS. Next comes is intramembranous ossification, where a fibrous tissue is going to ossify to bone. Okay, here the most common example that is frequently asked is maxilla. So apart from maxilla, there are other bones which are going to have this intramembranous ossification. That is your nasal bone, zygoma, parietal bone, omar, okay, and your lacrimal bone, zygomatic bone. The most commonly asked question is which of the following is seen in both? Okay, which of the following is seen in both? Your TOS plus your mandible. Okay, TOS plus your mandible. Okay, so that is temporal bone, occipital bone, and sphenoid bone plus mandible shows both intramembranous as well as endochondral ossification. Okay, so these ossifications are very, very important. Okay, there will be slight difference from reference to reference in few examples, but I want you to strictly follow this particular info which is taken straight away from Jitendra Sharan, one of the standard one to be followed for most of the MDS aspirants. Okay, right. So then I'm jumping into one more important topic related to your microbiology. Okay, right. So I hope like you're familiar, parasites are very, very important. So I see few of you are neglecting parasites, particularly malaria, damn important, entamoeba histolytica, damn important. Okay, so malaria, entamoeba histolytica are very, very much important. You need to learn top to bottom about malaria, top to bottom about entamoeba histolytica. If time permits, a few lines about other parasites. But you see in 2023 recent NEET exam, you have a question on entamoeba. Okay, and 2022 or 21 you have questions on malaria, so very frequently asked. So the hosts of these parasites were divided into one is definite to host, and second one is intermediate host, definite host and intermediate host. And when we're talking about protozoans, okay, so definite host is a host where the sexual cycle takes place, whereas intermediate host asexual cycle takes place. When I'm talking about helminthic parasites, okay, so definite host is a host which is going to host the adult form, whereas the intermediate host is going to host the larval form. So that is the difference between the protozoa as well as helminthic parasites. When I'm talking about most of the parasites, humans are definite. Humans are going to be definite hosts. Most of the parasites, the definite hosts are going to be humans. Okay, that's very, very important. And now we need to talk about the exceptions. Exceptions are very frequently asked questions. So they can ask you in which of the following human is considered as intermediate host. So you need to remember this. Humans, we always, what we do, humans definitely have pets. Humans are definitely going to have pets. And P for, you're familiar. Okay, so P for Plasmodium, P for Plasmodium, E for Enterococcus, E for Enterococcus, T for Toxoplasmosis. Okay, so Plasmodium, Enterococcus, Toxoplasmosis are exceptions, whereas rest other parasites, okay, humans are going to be the definite hosts. So humans are definite hosts except for Plasmodium, Enterococcus and Toxoplasmosis. In few cases they rarely mention about this third host apart from the primary host and secondary host, that is your definite host and intermediate host. Okay, there is one more host called as third host. The third host is also called as paratincic host. Okay, it may be sometimes called as carrier, it may be sometimes called as transport host. This is nothing but called as third host. Okay, so there are few lines that you need to make a note about. Malaria, the infective form for the humans is going to be the sporozoites, whereas the infective form for the mosquito is going to be the gametocytes. Go back and please do check the malaria life cycle, all the important points related to the malaria and everything. Okay, so when talking about the different types of malaria, okay, right, so the incubation period is going to be maximum for maximum MA, right? So intermediate is going to be maximum for malaria, okay, whereas it is minimum for minimum means fast, it is going fast, minimum is falciparum. Okay, minimum is falciparum, fast. Okay, maximum is MA malaria. Okay, right, I hope you are very, very clear with these contents. Okay, so I'm done for now. I'll be coming with few more series of videos where I'll try to cover the most important topics, concepts and important areas which are very, very frequently asked in this leftover days before you take your exam. I hope these videos are going to be useful, effective. Okay, so please do mention in the comment box about the question which I have asked related to the pin index value of nitrous oxide. If you have any sort of topics that you feel to be discussed, not subjects, I'm very, very clear. Okay, subject cannot be discussed as a short form. Okay, if you want any particular topic to be discussed, you can post those topics on the comment box, and we'll try our best to include those topics within the discussion part. And stay tuned to this particular channel, okay, for further more videos and updates related to your upcoming examination. Bye, take care, study well.